Nurses and midwives across the country embarked on a strike, a nationwide strike yesterday. Day 2 of that action. Yesterday, we monitored the situation from the Korle Bu Teaching Hospital. My colleague and our roving man, Emmanuel Kranting, is at the Rich Hospital, the Greater Accra Regional Hospital this morning. He'll bring us a situational report. We'll cross over and go to Tamale, the Tamale Teaching Hospital, and touch base with Martina Bugri, who will also be bringing us up to speed with what's happening there. But first, let's go to the Greater Accra Regional Hospital, the Rich Hospital, with Manuel. Manuel, what's the situation there this morning? Is it different from what you reported from the Korle Bu Teaching Hospital yesterday?
Well, Mavi, absolutely nothing different.
Well, we apologize there. We seem to have issues with the sound. Manuel's sound is not audible, so we're going to work on that and link up with Manuel Kranting in a short while. But in the meantime, let's go to Martina Bugri, who's reporting from the Tamale Teaching Hospital. Martina, good morning to you. What can you tell us with the strike and the impacts at the Tamale Teaching Hospital?
Currently, I am at the where the women would normally come for antenatal. And you can see behind me some women who are here, but there's nobody to attend to them. And so they've been here since morning, and up till now, no one is attending to them. Now, I went to the OPD, which is the entry point into the hospital. And I must say that the place is very empty. Nobody is there. Those are the files department will tell you that go and see the doctor. If the doctor is ready to attend to you, then you can come for your file. And that has been the situation. It looks like the message has gone far and wide. And so at the OPD, the place is empty. I also went to the emergency ward where I'm told that they are not taking in new patients. What they are doing right now is those on admission, they are taking care of. And so at the TTA, I would say that the strike action is biting really hard. Now, what makes the Tamale Metropolis or the Northern Region a peculiar issue is that here we don't have too many private hospitals. You cannot count up to 5 well-equipped health centers which can help people in times of need. And so it makes the region, the situation more difficult for us in the Northern Region.
And Martina, have you had any of the doctors in particular, because I understand it's impossible for them to even do their work without the nurses?
Doing discharges, but as it stands now, it doesn't look like they will be able to work, because who is going to receive the patient, who is going to take the vital statistics, who is going to lead the patient to the doctor? I met someone who's been booked for surgery today. It doesn't look like it's going to happen.
What are the other patients that you've seen on the ward, those who have come to the facility? What have they been telling you?
Well, what some told me was that they have attended to them since they've been here, but it doesn't look like it would last long.
Well, Martina Bugri is still monitoring the situation from the Northern Region, Tamale Teaching Hospital. That's where she is currently. She'll be bringing us more updates. Martina Bugri there. We'll cross over to the Rich Hospital, the Accra Regional Hospital, where Manuel Kranting is also stationed. We'll bring you that update as well. Manuel, hopefully we can hear you because we lost.
Hello.
Yes, Manuel, we can hear you now. Explain what's happening there.
Great. So, like I was saying before, you lost contact with me. Well, the Ridge Hospital doesn't have any different picture. Just as we saw at the Kolebu Teaching Hospital yesterday, we are having the numbers building up here. I could count well over 200 patients who are lurking around, expecting, the arrival of the nurses. They've been told that the nurses are on strike. I've seen that the records folks have been doling out some numbers to them to assist them in, as it were, counting. Well, I see doctors, trying to walk to the ward, but essentially what you have is in your shot now, some of the patients who are fervently, hoping that the nurses will come to work today. And so the picture, in fact, the tussle between the nurses and then the employer, government, seems to be going on regardless of the fact that the NLC, National Labour Commission, says it has secured that injunction to prevent them from embarking on the ongoing strike. They are maintaining that they've not received and they've not been served. And so they're still going ahead with the strike this morning. And so now you could see quite better the numbers that are building up here at the Ridge Hospital. All of these people are expecting to be attended to by the nurses. Regularly, you would have had the nurses on nightly duties taking care of them by now. But as you may already know, yesterday there were no nurses who reported to work. That has spilled over this morning, and you're having the numbers building up. So I'm going to try to speak to a few of the patients here and try to, find out from them how long, for instance, they've been here, where they're coming from, what they are expecting, to receive here, whether or not they're even hopeful, really, that the nurses will come to work this morning. So I'm going to try to speak to this man here. He's already agreed to speak to me. So, boss, good morning.
Good morning.
Great. You have been here, since when?
Yeah, I came around 5:30 a.m.
5:30 a.m. Yeah. And I'm like, well, it's almost 7:30.
Okay.
And you're still here?
Yes.
But what did they tell you when you got here?
They said the nurses are on strike, but they are hoping they will come. So they've taken our cars and everything. So we are waiting for them to come so that they will see us. Then the doctors will also take care of us. Yeah.
Well, pretty much the same picture we saw yesterday. We were hoping that the nurses would come to work, but we didn't see them coming to work. Are you hopeful that you see them?
Yeah, we are hopeful that they will come, yeah.
But where are you coming from anyways?
Oh, Kanda Estate.
All the way from Kanda Estate, and you've been told that the nurses are not working today?
Yes.
So in the event, the most, very likely event that they don't come to work today, what are you going to do?
Oh, I'll still see my doctor. My doctor will be coming, so I'll still see the doctor, yes. Okay. Yeah.
So you still see your doctor?
Yeah.
Well, so that's what he's telling me. He's telling me that, well, you still see his doctor anyways. And Mamavi, just a picture. This is really taking a toll on the smoothness of the work that the doctors themselves do. Yesterday I was at Kolebu, and they told me that the absence of the nurses in itself is an impediment to the food, because they have to take their vital information and so on. All these things are not being done. And it's not only the nurses who are on strike. You have the anesthetist also on strike with their allied members. And so it's quite vast, the extent of coverage of this strike action. I'll try to speak to a few more people. Back here, there are a lot more of the people who have been giving their numbers. And I'll try to ask them what numbers they have, and how soon, if at all, the nurses come to work this morning, how soon they are going to access the facility. And so let me get a bit closer to the man here. Hello, good morning. Good morning. So my name is Wano. What's your name?
My name is Vinolia.
Vinolia, you've been here. How long have you been here?
About, 2 hours ago. I was here around 4:59. Almost 5 o'clock I was here.
Almost 5 o'clock. Yeah. And what did they tell you when you got here?
The nurses are on strike. That's what they tell us. So we should wait. Whether they will come or not, they will see what they will do about it. And that's what they told us. So
but how long have you been told to wait? Did they give you a specific duration that you're going to wait?
No, they said we should wait. Let me say about 50 minutes ago. That's what they told us.
So you are hoping that the nurses will come?
I'm not sure they are coming.
Okay.
I'm not sure they are coming, because we have waited for about 30 minutes now. They are not coming.
You are not sure they are coming. But what are you going to do?
We are waiting. If the doctors will say we should come, then we'll go to the doctors. What they will do to us, then we accept it.
Okay, so what number did they give you?
I'm number 8.
Number 8. Yes. That means you came quite early.
Yes.
Okay. So if they don't come, you leave here?
Yes, please.
Okay. So you're getting a picture. More people just torn between whether or not the nurses are going to come this morning. Some of them deciding that we'll just see the doctor and leave. If we don't see the doctor also, we'll leave anyways. My boss, she's saying that she's going to leave. She's number 8. What number are you?
She's my wife.
Oh, she's your wife, and you brought her here. Are you confident that the nurses are going to come?
Like by now, they should have been in, but since they are not in, we are waiting some more to see what will happen. Yeah.
In the event that they do not come,
then we have no option than to go home.
But how serious is your wife's condition?
No, not it's me, myself.
Your condition.
Yeah. Well, I get a broken leg, so I'm here for review.
Okay.
Yeah.
You have an appointment already?
Yeah.
Okay.
So I'm in for review.
Okay.
I want to see the doctor.
All right.
Yeah.
Great. So he's here to have a review. He has a broken leg, and you're getting a picture that the strike is indeed disrupting all of these appointments. Yesterday at Kolebu, a lady who had an appointment at the cardio center had to be turned away because the nurses who were going to have first of all assessed her before she saw the doctor were not around, and that is seeming to be the picture that is building up in almost all the health facilities, and even here at the Ridge Hospital. I've seen a man around who has been giving them the numbers. I want to find out what really his confidence is, giving them the numbers and not just telling them what it is that the nurses are not coming. But I'll try to speak to a few more people before that. My boss, good morning, sir.
Good morning.
Great. So how long have you been here?
About an hour and a half, I think so.
An hour and a half. You are, what number are you?
29.
29, far back. What are you here to do?
I'm on a referral.
Referral from which hospital?
From a private clinic.
Okay.
Yeah.
Okay.
Yeah.
And what did they tell you when you got here?
Well, they have taken my distance, but they say I should wait. They don't know whether the nurses will come.
Okay.
I have to go and see a specialist. That's why.
And so why are you waiting? Why not maybe find another place and go?
Well, I'm waiting to see what will happen.
You're waiting to see.
Yeah, because I'm purposely referred to this place.
Okay.
Yeah.
Okay.
Yeah.
You've been purposely referred to this place. So some people also having been referred to the Ridge Hospital as you're having it this morning. And that's generally what's happening here. More and more people trooping in to the Ridge Hospital to access healthcare. The bad news, however, is that the nurses who would have attended to them are not on duty this morning, which means that, well, whether you like it or not, you'd have to wait. So there are two options. Either you wait or you move away. But this man behind here has been doing something. He's been giving them numbers so that in the event that the nurses come, there's an orderly, progress of events here. And so I'm going to try to speak to him right now and get what the intention really is. My boss, good morning, sir. Yes, sir, good morning. So, would you been giving them numbers?
Yes, I've given them numbers.
But what do you do here yourself?
We are the record officers.
Okay.
So, our duty is to give the patient numbers.
Okay.
So we are waiting for the nurses to come.
Okay. But what's the level of communication between yourself and the nurses?
Well, we learned they were on meeting. So, don't know what will happen to the meeting.
Okay.
So we are waiting for them.
Okay.
Yeah.
Okay. So so it means that they've come to work, but they are meeting.
Yes.
So the nurses are on the premises.
I don't know.
Okay.
I learned from some sources that they are having some meetings. So I don't know the place they are having the meeting.
Okay. So in their absence, yesterday, for instance, you had the progress of the day in their absence. How was it like yesterday?
Yesterday, in fact, I was not here.
Okay.
I was not here.
But ordinarily, what will it be like today? How is it going to be if they don't come?
If they don't come, I think they have to report to the director of the hospital.
Okay.
Okay.
Okay. So, what, the numbers keep building up? Do you have space to accommodate all the numbers that are building up? It's just, 7:30 this morning, and the numbers keep building up?
Oh, yes. Since almost 7:30, the number has raised up to 86.
Okay.
So, you are now having patient number 86.
Okay.
So, you are waiting for the nurses to come.
Okay. Would they be able to access, or you have access to the doctors without the nurses?
No, you don't have any access unless the nurses come.
So if the nurses don't come, no patient to be seeing a doctor today?
For that one, I can't tell.
Can't tell. Okay, great. So this is a picture of what's happening here. The man has been giving out numbers to the patients who are here to access health care. The doctors, well, some of them are around, but they are waiting for the nurses who are, if you like, the first point of call before anything happens in the hospital. All of them, without anyone left out, all of them are not available. And so these are the pictures here, the patients stranded, hoping that the nurses will come. Whether or not they come, we'll try to bring you the pictures as they progress this morning. So from the Ridge Hospital, Greater Accra Regional Hospital, my name is Manuel Cranting for JoyNews. Mamavi.
Yes, Manuel, thank you very much. Manuel is still monitoring the situation there. And if there are new development, he will certainly bring us up to speed. Our roving man, Manuel Cranting, reporting there from the Ridge Hospital, also known as the Greater Accra Regional Hospital. So you see patients waiting. They've been given numbers. The last count from that report is 86 or so, waiting to see if the nurses would come forward and prepare them so they can see the doctors or the consultants. We will be telling you what the situation is, even as patients stand by, wait to see what happens. This is not just happening at the Greater Accra Hospital. We've had report from Martina Bugiri, from the Tamale Regional Hospital as well. And indeed, this is the picture across the country. It's a struggle for better conditions of service, the nurses say, also backed by physician assistants and certified anesthetists. Let's speak to a labor consultant on this developing issue. Mr. Mohammed Afum joins us for a conversation. Good morning to you, sir. Thank you very much for your time.
Good morning, and thanks for having me.
I'm sure you've been following this development. The registered nurses say, for instance, that there was a meeting called last Friday, and they thought it was going to be a continuation of the negotiations for better service conditions. But it turned out that the employer was simply interested in knowing why they wanted to embark on a strike. And so they've decided to go on the strike. We know the National Labour Commission has secured an interim injunction to stop them, but they say they have not been served. So this action is still effective. How can we resolve this?
Well, thank you. It is very regrettable that a section of health workers have embarked on a strike during this pandemic, which is very, very frightening. I believe that the nurses and the employer will look at the seriousness of the situation and then go back to the negotiation table for negotiations to continue in a bid to reach agreement on the outstanding issues. That if there is a deadlock, I expect that they will do what the law requires by going to the National Labour Commission for them to institute a panel of arbitrators for compulsory arbitration to be done to resolve the matter within 2 weeks.
No, you kindly come again. You said compulsory arbitration, but this is who is supposed to take that action? Who is supposed to make that move? Right now, is the employer that's suffering from this action, isn't it?
Yeah, what is happening is that the labor law has categorized certain sectors as essential services, including the health service, the health sector, where the workers and the employers are prohibited on lockout or strike. But this prohibition has been compensated by expeditious resolution of the dispute when it occurs. The law states that when a dispute in essential service occurs, the worker and the employer are required to strive to negotiate in good faith and then reach agreement within 3 days. If there is a deadlock, then they have to go to the National Labour Commission to undergo what we call compulsory arbitration, and the award of the arbitrator is final and binding, and that will end the dispute. So this is what the law requires for the dispute to be resolved in essential service.
Okay.
Because the law recognizes that when there's a strike or lockout in essential service, it can result in a total loss of life, pose a danger to health and safety, and undermine the national economy. And that is why the law has prohibited essential service workers or employers from embarking on lockout or strike.
Okay, but at this point, should we be going strictly according to what the law says, or we should find another kind of language to speak?
My view is that I expect the leadership of the workers and the Fair Wages Commission that leads public sector negotiations on behalf of government to convene immediately and then continue the negotiations. And as I did say, if there's a deadlock, they should go to Labour Commission for them to trigger compulsory arbitration measures to have the matter resolved within 2 weeks while they are called off the strike.
Could that have been done instead of this interlocutory injunction that the National Labour Commission went to court for to stop the nurses from embarking on the action?
I believe that the National Labour Commission went to court because the union, which is the workers, defied the law and backed on strike. You know, as I indicated, the labor law says that essential service workers have been prohibited from embarking on strike. And in that regard, I also believe that when they are negotiating with the employer, both parties should negotiate in good faith. Parties should not delay unnecessary. Parties should answer questions. Parties supply information so that negotiation takes place with the purpose of reaching agreement. And that those from the management side who are negotiating to the people who have been given sufficient mandate take decisions. If all these things are not there, then you may have a situation where the workers will decide that the employer is not negotiating in good faith, and therefore we should use the weapon that we have at our disposal, and that is strike. And it's very unfortunate that strikes do not, are disruptive, to the economy, to society, and it may result in that where you have workers in essential service like nurses and physician assistants embarking on strike. Well,
Mr. Afum, we thank you very much for your time. That's a labor consultant there. Let's also stay with the phones. Let's speak to Deputy Employment and Labour Relations Minister Bride Rekubrobe. Good morning to you. Thank you for your time. How do you intend resolving this current issue? Is day 2 of the strike that's been called by the Ghana Registered Midwives Association. It's also backed by the physician assistants and the registered anesthetists. Over 80,000 of them were told, and we've been monitoring the situation from some facilities across the country. Patients are waiting, doctors are available, but they can't see them without first being prepared by the nurses.
Yes. Mama V, good morning and good morning to your cherished viewers. I actually just granted an interview to your sister station, and I thought that you'd have picked both. But what I said earlier was that, in fact, matters of this nature are not resolved by one ministry. They are matters that come and must be looked at from all perspectives. So the the mother ministry, which Ministry of Health, the Ministry of Finance, the Ministry of Employment and Labour Relations, and all the institutions that matter come together to resolve this. So certainly they take time. The nurses will agree with you that these matters that they have brought are not matters that emanated even a year ago. They are matters that have, been there with us since probably 2000 or even earlier.
Isn't that why it is very surprising that we haven't been able to resolve it and it has come to this?
But the question you must also ask, is it the reason why 2 months to elections you must hijack everybody and say you are going on strike? No. These matters have been on the table, and this government has been the most responsive since 1992. They have been the most responsive. All the chronology of events, the meetings that we have had with all these bodies emanate and are initiated by us. So you can talk to them. All the meetings that we have had are coming from us. Fair Wages and Salaries Commission will write to these bodies and ask them to bring proposals. They will bring the proposal, you write to them again. But remember that they have to always come to the superiors to seek mandate. And these are called negotiations. So when you go to the table, you go to the table and something is not acceptable, you come back. So negotiations have not stalled. The law took all of this into consideration. We are at a stage where we are still talking. We are still talking. We are still negotiating. So if one party says, I am resorting to a lockout or strike, and more so, this is an essential service. But you know, anticipate all of these things.
You know, sir, it's a bit hard to understand why, if you were talking and you were progressing with that conversation, they will suddenly say that they are laying down their tools. What went wrong?
No, anytime you say you are laying down your tools means that you have spoken with this person. The law says if you come to a stage where the other party is not being responsive or is not meeting your end, you have some 7 days, you have some 3 days. The law anticipates all of these things. Why are the nurses and midwives not sticking to this timeline? You have to ask them. The law, Mama V, the law that allows you this morning to come to work without any problem, without anybody meeting you and hitting your car, without anybody, harassing you. This same law is what has asked us to do what Labour Commission has gone to do. Labour Commission itself is lame. So it went to High Court, secured an injunction within 24 hours, just to tell you that please hold on, and that you have constituents. So they may ask, probably you are not fighting for them. But if the law says that stop, it's the nicest way to tell your people that yes, we wanted to embark on this and press home our demands. But the law says we can't do that. The law that enables you to wear your uniform and go to work. So that's what we are saying. I'm pleading with them. Well, I'm pleading. We are not in normal times. And remember, all of these stakeholders and leadership that must help resolve these matters. We are either also going for elections or whether these are MPs, these are government functionaries, some are moving with the president. But this matter became so important for us that we had these things on Friday and ensured that Labour Commission gets injunction, not because we don't want them to go on strike, but because we want to talk.
But are these issues that can be resolved before the elections?
Oh, sure. I mean, they tabled about 8 or 9 new issues which they brought. 6 of them have virtually been resolved. We are just left with about 2 or 3. And we can do this. We have a president. We have a president who is so mindful of Ghana, who is so mindful, especially our health.
My conversation and understanding yesterday was that out of the 9, you only agreed to 1. So it's a bit surprising to hear that 6 of them you're in the process of.
We have agreed in principle to like 6 of them. And as part of negotiations, what we do all the time is when we agree, we even go back and update. I mean, we do arrears, we do whatever. So it's not as if we are agreeing and will not pay you. Please.
So what are the so sir, because this morning we've listened to patients and we've seen them waiting, people who have appointment, people who are not well, who have gone to the facilities and they are still just sitting around and waiting. So what have we reached? What have we decided? What are we paying them exactly? Because Mama, we have to reach a certain compromise.
That is my worry, and I share in your worry. I'm an ardent viewer and listener to your program. So this morning, when I heard you on the paper review, it's as if we are not minding the nurses and we have created the problem and brought us where we are. The problem we have here, since even 2019, I mean, let me not go too back, but 2019, we asked them that bring your matters and let's talk. While we do so with the doctors, while we do so with the pharmacists, sometimes some of these issues, discussing them on air is not too pleasant because matters of labor and government are just like marital issues. We don't discuss them openly. But there are things that go on behind the scenes. We have spoken to them. Minister Bafwewa will be the last person you see talking to the media. It's because he thinks that anything labor can be discussed without media attention. And so we are pleading with them. We've gone very far. We've gone very, very far. All the allowances that we've said, you can speak to Perpetua. She will tell you that we initiated the fact that we need to go to the whole country and tour the facilities. We had meetings with the facility managers, seeing how best they could pay some of these things at the facility level. For instance, on-call allowance. These are allowances we cannot put on payroll because they come as and when we need to pay you. And therefore, the facilities have pledged. Dr. Boade, who is the Director General, has assured that the facilities, even they can pay, they should let us know so that we see which one government can support. Some of these things are all on the table. I cannot understand why all of a sudden we will ambush anybody. The law anticipated this. That is why he said, we give you 7 days. Give them notice within 7 days. We had the notice on Thursday. And feverishly, we have called all our members. I am MP for Himai Lower Dentra. Friday, I was in the constituency. I had scheduled meetings. I had to cut them short, defying my chiefs and all that and coming to Accra because this is very important. We cannot allow this to happen. So I'm appealing to them through my minister and through His Excellency the President. All of them must get back to work and the leadership should meet us.
So you're making this appeal, but the National Labour Commission has gone to court to get them to come back. What would we see in the next couple of days? Otherwise, what would we see today, tomorrow? Give us some assurances. There are patients watching you.
In fact, by close of today, if the union said they had not even seen the injunction, as at today, yesterday was a holiday. Today, we will formally ensure that they are served. And then by close of business today, I am pretty sure, I am very, very sure that they would order all their staff to go back to work. And tomorrow, Labour Commission has summoned all of us to the meeting. So we are going to meet tomorrow and start constructive engagement and ensure that in the shortest possible time, this matter is resolved.
Finally on this matter, sir.
I must put on record that, please, it is not everything which we can, grant all the requests. So the name is negotiation. When we come to tables with entrenched positions, it becomes difficult for government. But we need to reconcile demands with the figures and statistics of events and things that we have. So it is not as easy as it is. When I was in the private sector, I saw things differently. But coming into government, it is something else. So
we appreciate that. We appreciate that, and thank you for saying that. But just finally, I want to say that when you're talking, don't you realize that it is coming to this point where they're going to say they're laying down their tools? Can't you stop it before it gets to this point?
No, we anticipate. Even the proponents of the law anticipate that any time you talk, there is likely that one will not understand and one will say, no, I'll go on strike or lockout. So the law anticipates all of these. So the question is, will you also put to the nurses that the 7-day notice, have you given 7-day notice to your employer? That's a legitimate.
Did you meet them last Friday or not? Because I understand there was a meeting, but the meeting was interested in knowing why they wanted to go on the action instead of continuing with the negotiation.
But that is even a first step. That's even a first step. If you are back on something and then we call you, I heard that they wanted to have a formal invitation to the meeting. I called my minister immediately. We called Fair Wages and Salaries Commission to send them formal letter that government wants to meet you. And when we meet, the first question legitimately is, why are you going on strike when we can sit down and talk? So it is legitimate, Mama. It's legitimate. Talk to them and ask them that, why are they also not respecting the 7-day notice which they have to give to government?
Well, we will leave the conversation here, but just to say that around this period, it's a very tricky time. If you embark on an action like this, you should have your issues resolved, because the election is just around the corner, and everybody knows that you can't afford to play with that. So you should also be mindful of that. But thank you for your time.
I have heard that some of them are saying government is intimidating them and so on. I think that they are rather also even holding us to hostage. They are also intimidating us. So please, let's get to the table. I am pleading with them. I meet all of them. We speak and we talk. And the kinds of things that government must do to them, if they would bear with me and also be very frank with, you will see that this government has been very responsive. Anytime you call Admamenu, he's ready. If you call Bafwewa, he's ready. The finance minister has always, if not there, been represented by Abna in all of this.
Well,
so we should get back to the table and talk. I'm pleading with them that we should go back to the hospitals and clinics and health. You know, those in Accra and Kumasi can have access and go to private facilities.
Well,
but those in our rural communities, it's a big issue. So please, they should let them go back, respect the law, and then come and sit with us tomorrow.
Well, on behalf of the people, we need you to resolve this issue immediately. Thank you very much for your time, sir. That's a Deputy Employment Labour Relations Minister, Bright Reko Broby there. Let's jump straight away to voters' voice. Today, we're concentrating on first-time voters, and we're asking what will influence their decision in the 2020 polls. And the destination is OT and Eastern regions. Hear our voices.